Okay. Hello everyone, my name is Kaylee Denham. I'm a women's pelvic floor physical therapist. For those who don't know me, I own Her Physical Therapy and Wellness in Post Falls, Idaho. And I'm here in Kelowna, BC. And I've just taken the first day of my level 1 low pressure fitness-Hypopressive course. And this is Trista Zinn, and she is a master trainer and instructor. And I'm really excited about what I learned today. And I found out about this method a couple years ago. I was trying to figure out my own pelvic floor rehabilitation journey, prolapse, diastasis. I had stress urinary incontinence at the time, an umbilical hernia, and a baby. And so I was just really trying to figure out what I could do, and I came upon you. And I was doing an internal exam on myself along with the technique after we did our Skype session. And I was amazed at what my pelvic floor did in response. Like you said it was going to happen, and it did everything that I wanted it to do. The lift, everything moved up. It wasn't this big bearing down, because you think of that apnea breath, holding your breath.
Because it can be done wrong.
It can be done wrong.
Yeah.
So I was just really excited when I saw this course was close by. So maybe you can just give a little bit about your background, how you got into it, and
Sure.
then we'll go from there.
So I'm a trainer, not a physiotherapist, but I've been in the fitness industry for close to 28 years. I do have kids. I've got a 17-year-old and a 12-year-old. And I too actually came upon the technique for personal reasons. I was, found out actually, I had taken this pelvic floor Pilates course, and learned about what a prolapse, pelvic organ prolapse even was. I never even heard of it before, and I was 40 when I took the course, so it was a bit of a slap in the face to hear that, yes, your organs can descend through the vaginal canal. Mm-hmm. It talked about incontinence as well, and I had heard about that. I hadn't had any signs or symptoms that I'd known of pelvic floor dysfunction after giving birth to my 2 kids. However, at this course, I had found out about pelvic floor physiotherapists, and again, something I didn't know anything about. And I do recommend that women go see a pelvic floor physiotherapist, even if they treat it like an annual,
right?
Just to get assessed, get a base mark, see where they're at for prevention, if anything. So I started telling all my clients, all my female friends, you got to go see a pelvic floor physiotherapist. Even for my clients, so I had a base mark as to what we were doing in the gym. I didn't want to create problems or exasperate something that maybe was already in progressed stages. They just might not have known about it. And it was at this pelvic floor physiotherapist that I found out I myself had cystocele, stage 2. It's a mentally exhausting piece of information to find out about. Of all the injuries that I had endured through my life and running as a runner and a trainer, nothing was as mentally exhausting and as emotional is to finding out that my bladder was descending through my vaginal canal. Mm-hmm. It's a very intimate part of your body. Mm-hmm. It's not an easy injury to talk about. I think the process that pelvic floor physiotherapists are going through now with their clients is a little bit different than it was back then. But back then I was told to stop running, stop doing all my strength training. So really I was abandoning everything that I would have done to help me emotionally cope with what I had just heard. Anyway, it's mentally exhausting. And it was through the whole process the same, where I'm trying to figure out, like, okay, oh my God, what am I doing? What not to do? How to breathe? How not to breathe? How to prevent this from getting to more advanced stages of progression. So I'd heard about this hypopressive exercise technique, and I Googled it, and there wasn't anything in English at the time. And I did what I recommend people not do now because it can be done wrong. But I started emulating what I saw the best that I could. And within 2 weeks of just self-practicing, my stage 2 had moved up to a stage 1. And that's where I was kind of like, oh my God, I got to figure out where I can learn this. As a trainer or a fitness professional already, I needed to take a course. I needed to bring it to North America or to Canada. Even if there was a certain percentage of the population that was going to respond the way I was responding, I needed to bring it here. Because there was no one here that was teaching this. So I went to Banyoles, Spain. Kaisa Tomei taught me privately the level 1. There'd only been one English course taught at that point because it had always been in Spanish. And after learning the technique and doing a level 1 course similar to what you're doing today or this weekend, I went home and I knew exactly what I was supposed to do and learned the postures, the poses, the details for the cues. And within a couple of weeks, my stage 1 now had been completely resolved and there were no signs and symptoms of the prolapse. And I kind of sent a little bit of a shockwave, I think, through the pelvic floor physio world as people started to talk and learn a little bit more about this technique. And so it started a whirlwind of travel for me to go back and forth to Spain to become Canada's only master trainer, and international course instructor. So my goal in helping others, I could only help achieve this goal if I trained more fitness and health professionals, so to bring them closer to the other women who are looking for guidance and to help to restore. So that's kind of how that's my long short story. I don't know.
But I think that's good because that really resonates like with other women who maybe are going through the same thing. I know that resonates with my clients because I'm like telling them about pelvic dysfunction, but I'm like, don't worry, I have all of them.
Yes.
Like I've been through that. I literally went through the grieving process, like when I found out, because mentally I was like this, healthy, active. I did everything right. I was a physical therapist. Like I only had one child, like everything was perfect. And then to have all this happen is literally like a blow to the gut. And I was just in denial. Like I literally went through the whole process, and it probably took a year to really like, okay. But it was like, social media has been helpful. Finding good
more
messaging
now than it has before.
But it can be scary out there.
I agree 100%. You definitely go through a process where you find out this information. There's a grieving process, like sad, mad.
Yes.
I was really mad.
Why didn't anyone tell me?
Yeah. How is it that I'm a personal trainer in the fitness industry?
Didn't know.
No one ever told me that my pelvic floor was part of my core.
Right.
No one ever taught me about the respiratory diaphragm as part of my core. It was all abdominal-centric exercises. Mm-hmm. I created it. I caused this dysfunction. And so there is even a point where, I remember lying in bed with my son and putting him to sleep, thinking like, okay, I don't have cancer. Right. It's me. Right. It's not my kids. Everyone's healthy. Like to try and make peace with it. Yeah. And then there is a point too where it's like, you know what? Oh my God, pull yourself together. Like get a grip and figure this out because I am not letting this define me. And I refuse to have something like this stop me from doing what I love to do. And surgery was not an option in my mind. And there had to be something else. And when I started getting the results with the hypopressives, like it was fast for me that I started to notice.
Well, and I was going to ask, is that typical?
It depends on the person.
Right. Well, and there's so much. Even I'll say that genetics plays a role in like the tissue.
Yeah,
and flexibility of it.
Totally, and sort of what causes the dysfunction, what causes their dysfunction in the first place. Is it about alignment? Mm-hmm. Is it a bit about the inability to properly manage this intra-abdominal pressure? What structural changes have happened? There's a variety, and that's one thing I think that you'll agree is the pelvic organ prolapse. Incontinence is, to let everybody know, it's any involuntary loss of urine.
Yes.
so many people think, oh, well, it's just when I laugh, or it's just when I sneeze, or it's just when
I don't have a problem. It's only when I jump on the trampoline.
Of core dysfunction
exactly.
if you are leaking urine.
Right.
Yes?
At any age.
At any age.
Yes.
And pelvic organ prolapse, the symptoms vary so much from one woman to the next. So I was stage 2.
And you didn't have
I
any
didn't
symptoms.
really know. I had like a little bit of a nagging pull or tugging in my pelvic floor, but it was only here and there. I thought I'd overdone adductor workout or something, but it wasn't constant. It wasn't pain. I had chronic piriformis problems ever since I had my eldest, who is now the 17-year-old, that after actually restoring my pelvic floor and using the technique, I do not have it all anymore. But I was constantly like on a ball in the car, stretching. Oh my God, cannot sit still, and I don't have any. So I really relate that to a dysfunction of the pelvic girdle. What helped me make peace with it a little bit, and I spoke about in the course, and I hope it will help others to see it this way too, but I could make sense of it if I thought of it as an injury. This is an injury. It's a symptom of an injury. And if I had a symptom of my knee was nagging me, how is it that I can mentally digest the fact that I cannot run for 12 weeks because I need to restore my knee? And I see a pelvic floor, not a pelvic floor physio, I see a therapist to help me restore the knee. As it starts to get better, and maybe now I'm doing something else, not running. I'm cycling, the elliptical maybe is fine, swimming. I'm modifying my exercise program so I can restore this back to health. And once it is feeling better and the therapist thinks it looks better, we're ready to start reintroducing activity, just like the pelvic floor. We've restored, things look better. Let's start to reintroduce the things you love. You don't start running a 10K. Right. You slowly okay, am I able to manage it? What's happening? What are my patterns looking like, etc. And you slowly reintroduce the things that you love. So the idea that this wasn't going to be forever, it was just in order to help restore and bring about a balance again within my system. Okay, I get it. And then I was able to move forward. And let's then deal and look and see what is causing this symptom. And go from there. Like I mentioned, as far as the upset with the fitness industry and the way they are teaching core, etc. The hypopressive course was equally a slap in the face as the course that talked about prolapse. Again, why wasn't I educated on this? How, as a woman at age 40 at the time, had I never heard of this? I didn't even know it could happen. And I think I do Skype training around the globe for those who are not near a qualified instructor who can't give them the hands-on.
Because they're not everywhere. It's not like yoga teachers.
Exactly.
That's why I had
there will be.
There will. Yes.
It's the crest of the
coming.
wave, or the crest of the wave.
It's coming.
It really hits home when you are meeting with woman after woman around the globe, different accents, different nationalities, different looks, etc. And they're all saying the same thing. They're all teary-eyed. They're all frustrated. Why didn't they know? How come no one told them that they could prevent it? No one's helping guide them recover or restore effectively. It seems like the go-to approach is still not as effective as we once thought it was. And I think the important thing is to know and to embrace and be open-minded to other tools that are out there.
It's a tool. I love that you said that. It's a tool.
It's a tool. It might not be ideal for everybody, but it might be the missing key for some people. Whether it's at the beginning stages of the recovery or restoration, whether it's later on, it could be that missing piece. And although it looks a little bizarre, it's a little bit of
but it intrigued me. I was like, what is going on?
Yes, exactly. But if we're open-minded and we're listening, then we can evolve. Then we can listen to our bodies and see what's happening. Be curious. Why? Why is some things working for some people and some not? Let's take a look at the big picture. Let's not just dwell on the pelvic floor. Oh, it's not functional, so let's keep training this without looking at the big picture. And I think more and more today, educators, there's more and more courses, I've seen them, professionals, fitness and health professionals, who are addressing the body as a
Yes.
whole, a big picture. They're not just looking at the one segment. And are addressing the respiratory diaphragm, which is a huge component, how it works with the core as a whole. So even in saying that, this could lead up into what hypopressives is.
I was just going to say.
Hypopressives is a core restoration and maintenance program that addresses the full body. So it's like a global approach to core health. So it's unfortunate, but many people, when they're told they're going to do core exercises or what they view as the core, think it's abdominals and think the program should be abdominal-centric exercises based only on movement patterns, etc. You and I know that the core is made up of the respiratory diaphragm, the pelvic diaphragm, these two domes, the transverse abdominals, the deepest muscle, the muscles multifidus in the back. So this canister. We know that this canister needs to work synergistically as a unit without thought, just with the ebb and flow of breathing to inhale, exhale, and it functions. So why train one piece at a time when we know it has to function as a unit? And again, we can't just train that one piece at a time. We have to look at everything from head to toe, which affects its ability to function. So low pressure fitness addresses the body as a whole with specific postures. So it's a postural and breathing exercise program. There's different levels. This weekend you're learning the basics, which is based on static postures and poses with this unique breathing technique, where we are creating what people see online is this drawing inwards and upwards of the abdominals. That is literally a reaction.
You're not forcing it.
We're not forcing it. We're not pulling the belly button in and trying to make it happen. It's a reaction that happened based on the fact that we closed off here. We go to do this false breath
After the exhale.
So we do our rest breaths. Another piece that's often missed on social media is people that's like the eye candy, you know? This abdominal, that looks pretty cool. We like to show it. But there's missing pieces to that image. And we do these rest breaths before we do this abdominal vacuum maneuver. And the rest breaths are as key because we're inhale, exhale. We're trying to bring about this synergy.
That's already supposed to happen.
So we need to retrain. Again, like you saw today in the course, we don't just say, okay, and start with apneas. We have to work with the person's breathing. Their breathing to begin with before we introduce this apnea. So it's on the final exhale, the third exhale, where we allow the air to escape without forcing it.
You're not creating all this extra pressure.
And we're not trying to get out the residual air. We close at the glottis and we go to mimic taking a breath, but we don't allow any air to go in. And it's this influence on the diaphragm and the pressure that's created within this abdominal cavity that we reposition the pressure, or we influence the pressure and change it, and everything gets drawn inwards and upwards like a vacuum. But we can't just do that one piece. And so again, on social media, or people see, they think, it's just about this breathing technique. But you can do that as much as you want to, but if you're not going to take a look at the big picture and you're going to continue doing whatever activity you do with poor posture, alignment, etc., it's only going to do so much. So we need to do everything from head to toe that's going to affect your overall alignment so these pieces can be aligned up and work with synergy. The postures and poses aren't, we're not isometrically holding with restriction and tight and contracting. We're eccentrically lengthening, opening, and creating space. So it's circulation, digestion, posture, or alignment, whatever word you like to use. Pelvic health, sexual health. It is helping you better manage the pressure. So we have to understand that dysfunction of the core can be seen in many different ways. You and I started talking about it from a women's pelvic health perspective, but dysfunctional core can be seen in men as much as it is in women. In women, it's not only related to the pelvic floor. if they have an abdominal hernia, if they've got back problems, back pain, sacral pain, this is a sign or a symptom that there is a dysfunction in their core. Maybe they need to put some of their activities aside where we restore the function of the core and then slowly reintroduce. A male athlete who is now no longer able to participate in his sport because he has abdominal hernia, there was an imbalance.
Right.
That's where his weak link was. If you keep tightening and tightening these muscles, building these exterior rectus, obliques, etc., like a tube of toothpaste, if there's a weak link, the pressure's got to go somewhere.
Right.
For them, maybe it was the abdominal wall. Women can have abdominal hernias as well, umbilical, inguinal, etc. So it can present itself in a variety of different ways. Because of a variety of different reasons. Yeah, the way we're training, our posture. We don't say that these sports and activities are bad for you. Everything in life increases pressure.
Right.
We're on a planet with gravity.
Yeah.
We're not saying to stop it. It's just how well are you able to manage the increases in pressure that you're placing upon the body. And we are offering you a tool to help you balance and counterbalance these increases in pressure. So I, as a runner, I go for my run. I do my TRX training now, which is the exercise I like. You do CrossFit. And what do? We do hypopressives after to counterbalance what we did in the gym. It's all about balance. If there's an imbalance, we have injury. No matter what. And it's a maintenance program because you can't just you are healed and you
never
are
have
now
to do that again.
Because you're just going to go back into your poor patterns. Eventually it'll start to go down again. I am confident that if I stop doing hypopressives altogether,
and went back
my
to your old
prolapse
strategies,
it would eventually start to come back again. Or possibly I would show signs or symptoms somewhere else if I had developed a weak link somewhere else. So it's really about how well are you able to manage what you're doing. If you're showing symptoms of incontinence and you're still going to your core classes,
it's not helping you.
No, maybe what you're doing is detrimental to your core and is creating this. Maybe that's where your weak link is. You need to restore and then redo some. So some of those ab exercises are still okay. We need to move the TRX. We're moving through space. You like to do your CrossFit, but it's about balance. What are those muscles put there for? What's the activities that you do in daily living? And are you using
them optimally? Well, and I think it's good to point out that if you do have surgery to fix these, they're not, it's just like putting a Band-Aid on it. You're not fixing the root cause. And you really have to go back and get your core retrained, restored, so that you can go about your life without reopening, reherniating something.
100%. Because, as you know, someone who has prolapse of the bladder, whatever, they have the surgery, it's hoisted up, now what happens? They have incontinence. Why?
Or it fails.
Because they never address. They just they addressed the symptom, but they didn't address what was causing the problem in the first place. So even for someone who's had surgery, hypopressives is brilliant because it still helps to improve the tone and the function of the pelvic floor. So with hypopressives, this low pressure fitness technique, we do not claim to strengthen the pelvic floor. We're improving the function and the resting tone because our posture is made up of tonic muscle fibers or ones that we don't need to think about. We just need to rely on, not actively contract all the time. So as an example, and you can maybe use this as an example with your clients since you're a pelvic floor physiotherapist, you would have the client come in and you have them do, okay, can you give me a pelvic floor contraction? See if they can activate. You know, some of them, there's a disconnect. They're trying to figure out, and you use the proprioception of your finger or a device to help them feel the muscles that need to be contracting and activated. And there's a bit of a disconnect. And then they start doing hypopressive training with you, and you're like, okay, you know what? I think we're going to add hypopressives. And they feel it. You feel, oh my God, the vagina, it goes up. The pelvic floor goes up more. And it starts to send a message to the brain. This is the muscle. This is the direction, and this is what's supposed to feel like. So then when your client comes back to you after she's been practicing hypopressives for a little while, and you're saying, okay, let's see. Now, how's your pelvic floor contraction or your ability to perform a contraction? And she's like, a light bulb goes, oh my God, now I know what you want me to do, because she's been feeling it.
Yes. She didn't have that awareness before.
No, now she has an awareness.
Yes.
And the technique is about a full body awareness. And now she's able to get a better recruitment. Yeah. So it lends itself to better strength this way. Yeah.
Yeah. Well, can you tell us what hypopressives is used for? Like what symptoms or diagnoses?
It can be used for a wide variety of things. Sometimes someone comes to you for one goal, a pelvic health goal. They have pelvic organ prolapse and they want to help reduce symptoms, alleviate pressure, pain, discomfort. So hypopressives can help draw everything back inwards and upwards and help to improve the resting tone to help keep it up and help you better manage the pressure so it doesn't keep getting pushed down. So we have clients coming to see us for pelvic floor dysfunction related to pelvic organ prolapse, related to incontinence, related to sexual dysfunction, postural re-education, whether it's someone with scoliosis or they need to maintain alignment for whatever reason, back pain, low back pain, respiratory function, respiratory dysfunction. What else? Well, it can help people with constipation. They maybe didn't come to me for this reason, but it's a perk, an extra perk. Same with menstrual cramps, menstrual pain.
I did not know that today.
Yeah, so it can help with this too. It can help actually shorten your cycle, the bleed, because it just helps to get everything moving. And the elimination process is a bit more efficient.
Maybe breaking up some adhesions or scar
Yeah,
tissue.
you get a really nice deep myofascial release. So even people who've had scar tissue.
Yes, I love that idea.
It's amazing because
it's inside out. Like, I can only do so much.
Yes, and the massage therapist, so it really works nicely if you want to network with other professionals, osteopaths, massage therapists, etc., who are going about treating from the outside. Hypopressives helps with a deep internal myofascial release and kind of goes like this from the inside. So then it can help maintain and kind of solidify what they were doing. Maybe solidify is not the right word because then it makes kind of solidify but it can help maintain the results that the therapist was giving. Because now they have something, it's not going to keep going back. They can get their treatment. They do hypopressives. It helps to improve. And then they go back to the massage therapist and they can't believe that they haven't become stuck again. And the work is much easier for them and longer lasting for the client. Same with the person with the hypertonic pelvic floor. If there's scar tissue that needs to be worked out from the internal, but it's still external. Pelvic health piece, you get a nice traction. And hypopressives can help someone with pelvic pain, as well as the other dysfunctions that we mentioned.
That's great. So many things. So everybody. Now there are some precautions or contraindications. Maybe you should speak to that, because if somebody's just like, I'm going to Google that tonight.
So first of all, you can do it wrong. You can do it wrong. Many people I've seen think that they're doing it right, and they're actually increasing pressure before they decrease pressure, or they think we're voluntarily pulling the stomach in.
Like a sucking, like I'm just going to suck up.
Suck in and up, which is incorrect. So if it's done correctly, yes, it helps a wide variety of people. Are there contraindications? Yeah, there's some contraindications. You wouldn't do this abdominal vacuum while you're pregnant. You wouldn't do it close after surgery, where it hasn't healed. Anyone can do the postures and the poses. And we just modify the breathing
Okay.
based on the individual and where they are in their stage of recovery, if it's because of surgery or postnatal,
Okay.
C-section, episiotomy, these kinds of things. It depends on the person if they have high blood pressure.
Okay.
Although there are contraindications that were made, and some of them were like, actually, it kind of, like it was safe for them to say a blanket statement before,
Okay.
don't do it if you have these conditions. But now we're realizing that, more people can do it than we thought.
Okay.
There weren't as many contraindications. You 100% should be working with a qualified instructor because you are the professional. You can watch them. People think it's done a lot faster, harder, and stronger than it is. It's slow.
Yes.
It's a light,
it's very gentle.
It's very gentle. It's much more gentle than a cough.
Yeah.
Which is the opposite. Downwards, hard, outward pressure, forced down. And if someone is coughing, that's a lot of pressure. This is just a light sliding glide. We're not asking everybody to hold it for long.
Right.
And when we're doing the technique, if you watch the people who are doing it,
you're not straining. There's
no. We're like,
Yes.
we become one with it. And there's a very nice mindfulness component to it that helps someone who has high blood pressure to have them like,
Calm,
to breathe, focus on the breath, release, inhale, exhale. I have one male client who every day at 4:00 closes his office door and does hypopressives. Yes, because it reoxygenates, postural charges. It's more sympathetic in nature, so you're left with a heightened awareness.
Okay.
It's not like parasympathetic nervous system, rest, digest kind of thing. It's more, I feel lighter, taller, with ease, and you're more alert.
Okay.
And because it is respiration, you're focusing on the breath, you're focusing on yourself, where you are in space. There's a lovely mindfulness component to it. That's got an intensity to it, because I
mean, it's hard.
It's hard.
It is. That was harder
for
than
sure.
I thought it was
Yes,
gonna be.
totally. So,
and we did one posture.
So when I started, I'm like, oh my God, this is the slowest, hardest thing I've ever done in my life, right?
Yes.
It would have been easier for me to run hills and stairs than to be here, breathe, focus.
Yes.
And it's like we're going like this to the
Yes.
posture. Maintain. Where you have to hold it. So even the athletes can find this a challenge, right? Because they're so used to using their external self, empowering controlling everything, that this we have to kind of let the internal being take over, And I use it a lot in the course where you have to allow it to happen.
Yes.
If you try and force it and make it happen, you lose the intricacy of the technique and it gets lost. So where were we? I'm lost. I'm lost in what we were where are we?
We were talking about the contraindications.
Oh yeah, contraindications. So work with a qualified instructor. Make sure that they can guide you appropriately. It's slow, gentle. We're not getting you to hold for crazy long periods of time. It's all based on the client's needs and their ability. Postures and poses anybody can do.
Any age too.
Any age. So they've been working it with.
On there.
Pardon? Yes. And I actually have to do a post with my mom that I haven't figured out the wording part yet because she does cycling and my dad. Yeah. So any age, as well as my son, 12-year-old. I try and get him. We're trying to work with your family is a little bit harder than. Yeah. But they've worked with kids as young as 7 or 8 for postural re-education. Those with scoliosis. It helps them perform as better athletes. If you can breathe better, you can perform better. If we keep locking our abs in to tighten, how do you swing a tennis racket? How do you move even through yoga poses? I have yoga instructors who got into this whole trend of engage your core, blah, 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 this language that keeps coming out, engage your core. What? Engage the core? It's supposed to come on. In yoga, I thought that's the brilliant part about yoga is the movement patterns themselves should recruit without you having to think, belly button towards the spine, engage. So the same as any athlete. How do you move as an athlete? If you keep locking your system down with all this abdominal exercises, you can't breathe.
Yeah.
And breathing, if you can
That
breathe,
is key.
that helps you heal.
Yes.
How do you heal? Oh, circulation. Breathing helps you with circulation, helps you move. You can become lighter, stronger, mobility and fluidity. So those who like to do strength training, oh, it's a perfect balance because now you can perform better as a, oh my God, now I have this length, so now I can contract.
Yeah.
Yes? Same with the pelvic floor.
Yeah.
Oh, now I
Love
can do
that.
this. Now I can contract. It's the two. Balance. It's all about balance
Yes.
for the mind and the body.
I love that. I'm really excited to get to use this, and maybe that's a good segue into how do they find you? Is there a website for instructors?
Yeah. Sure. So my personal website is coresetfitness.com.
Okay.
So you can maybe put it in the
Yes.
bottom, but coresetfitness.com. All the instructors who take the courses with me will go onto the Hypopressives Canada website,
Okay.
even though you're not in Canada.
Yeah.
There's more and more people coming from the US to Canada to learn the
Yes.
courses. So that's great. You'll be listed there anyway. And then you'll go on the